about 2 months ago, I started, or potentially 3 months ago now, started working on colleague care, education, trying to push for us to all look out for each other throughout disciplines. So your doctors, your nurses, your allied health team, and your support staff as well, to try and get us to appreciate what we do as a team and how we all work together to give our patients the best possible outcomes they can have. While I was doing that, one of my colleagues brought to me the K-ISBAR program that had been presented by Andrew Green, one of the anaesthetists, during one of his sessions. And I just found it really clicked really well. It worked really well to bring together what I was trying to do and an actual opportunity for staff to implement that. So rather than just saying, oh, we have to be kind all the time, giving people a time where they can focus on, this is where I'm going to inject kindness into my day.
So Annie, how have you been going at Latrobe Regional, introducing K-ISBAR into the clinical space, and what sort of impact do you think it's having?
So what we've been working on so far, we've started with doing a few 2 p.m. sessions during our Wellness Wednesdays that we run every Wednesday every week. Just educating people on what K-ISBAR is, what it means, how it fits into our already existing ISBAR system, as well as I've also been doing some presentations to our nursing students so that we're getting sort of that information into their minds so they can be thinking of what kind of nurse they want to be, what kind of teacher they want to be to their students in the future at that base level. So we're building that culture in our nursing baseline before they even start to us. And in the surgical theatre aspect, the surgical ward is going through a few different changes at the moment because it's such a large ward with so many challenges. They're constantly looking at different things they can do to try and make their day a little bit easier. So this is going to be piggybacking onto something they're implementing at the moment, which is a discharge nurse. So we will be having a meeting at some stage shortly to review how that's going, and I will be piggybacking in the K-ISBAR as well. I'm also setting up a meeting with the nurse unit managers of our surgical and theatre areas, as well as the clinical nurse educators from theatre as well, so that we can sit down and have a discussion about how it's working, because we have had a lot of feedback from theatre lately that their handovers from the surgical area aren't ideal. They're feeling like they're not getting the information they need. And the feedback I'm getting from the surgical ward is that they feel like when they're going over, they're getting criticised for not having certain things done in a way that they seem unfair. So we're starting to try and build a communication with our unit managers and educators to start with. And then hopefully I plan on meeting with a few of the clinical nurse specialists that work on those wards and trying to implement a few meetings between them so that we can just start that feedback loop between the wards. Me and the clinical nurse educator from theatre will be trying to facilitate those as best as we can so that we can keep them productive. And we'll be sort of taking down notes and evaluating the feedback as we go along.
I'd like to say it feels like a really big stretch to push something like kindness out into a whole organisation, and the way that Annie has started this just seems to have hit the sweet spot between making it achievable for any one individual to actually make a change by small actions. What Annie said about the surgical ward handover to theatre is just one recurring instance where, as she said, it seems like there's often difficulty. There's a difficult patient, a difficult situation, and it's predictable that the person taking the handover may feel stressed, and the person giving the handover may have had a hard time already, and where people are feeling like they're being criticised for the quality of their handover or the patient, even the state of the patient they're delivering, that might be an opportunity to make that a kind of process and actually affect a change in that. So a lot of the things that Annie's sort of started with in terms of having it clearly displayed on the wall right at the location of that frequent handover, having some post-it notes that she can go around and hand out a wad of post-it notes to the nurses that they can stick on the front of their theatre checklist sheet that they have to take with them. to a visual reminder in colour to everybody that this is one of our goals. It didn't even require that we change the hospital paperwork. It's a thing that we can add. We didn't have to go through a big process. But the recurring nature of that handover between just two hospital departments and rolling it out across a small subset of the hospital, the way that we might measure that it's making a difference is if the other hospital departments start to get interested in, oh, what's this? What's going on? What's that? What's that change you're making? And actually, we're interested. We want to get on board as well. Maybe eventually it's ICU or A&E that are also delivering patients to theatre and that involving themselves in that handover process.
I've had educators from ED and CCU approach me asking me about exactly that. So they will probably be next on our list is ED and CCU, because they often, again, advocating for their patients, trying to do the best thing for their patients, but sometimes end up clashing and addressing issues in using unprofessional behaviours rather than treating each other like the professionals that they are. So they are definitely the next list.
Yeah, and I think what we've found from other places is that kindness is infectious, and so if you do a great job with your department, it can be something that inspires other departments. And really, what your administrators need to do, you need to challenge them to champion what you're doing, because, like you say, Andrew, if you want to bring it across a network, it's going to require hospital administration to get involved to resource that. It's they will have their own cultural data, or they should have their own cultural data looking at staff satisfaction and staff retention rates across the organisation and where there may be a problem. And if they generally feel that there are areas that they can improve the culture of, this may be a tool that can work. And if you show it works in your department, that's all you need to do to inspire them to roll it out further. So it's wonderful to see that you've flagged the problem yourself and that you've got proactive and that you're using it. It's fantastic. I'd love to see the sticky notes, to be honest, to see if we can maybe borrow some of them back in the ICU at Cabrini. Would be great. I think you'll find,
for them, but they haven't been printed as yet. We're just waiting.
I think with the pandemic, what we're seeing in Melbourne is that obviously there are a lot of staff that are tired and exhausted and burnt out after 18 months. So it's something that Kath and I have spoken about a few times, how it can be utilised, not just during the pandemic, but afterwards. So we're hopeful that it's something that can stick and be part of a new culture. But yeah, I think little things like what you're doing, the other thing that other hospitals can do is they can look at K-ISBAR, and if it's not quite right for them, but the concept is right, then they can do a local adaptation of it, just like any guideline or checklist or cognitive aid. If it's not quite perfect for your institution, just modify it a little bit. And what we really want is exactly what Annie said in the first part of this discussion, was that the kindness should be focused at the time of your day that it's most important. And we feel strongly that handover is where it's going to have its biggest impact. So treating each other with kindness and respect during handover always, and challenging your staff to do that, is where we feel kindness can have the most impact in the health system. But it's fantastic. I know from personal experience, having gone between multiple operating theatres, particularly when you're a trainee and you go from one hospital from 3 months to another hospital, and you have to meet staff again for the first time, it can be quite daunting to do those handovers, exactly as you're saying. So having a process that makes that a lot easier it's a great location to start. So well done.
Well, really, for me, the thing about K-ISBAR being useful is that it sits in that very it sits on both parts of what it is that really stops us getting burnt out in this very difficult time with all the the changes and the stress that we're under. It actually sits in the part of the individual's ability to cope. In other words, if I call on my coping mechanisms to help me get through this, it might be that it is to to constantly connect with people and to to use kindness as a skill that I'm displaying. But on the same token, it only really works in preventing people getting burnt out if I can do something to make the system around me kinder as well. And that, obviously this is an opportunity for the individual to do even one little thing that can make a difference to the system, because it doesn't matter how well I am how good I am at coping. If the system is, is damaging, then, that's, I can't function. So, K-ISBAR is an opportunity for me to do both things, to work on my own ability to cope and also to affect the change around me.
Yeah. And when I talk about it with the junior staff in my hospital, one of the things I always say is you never know what the last 2 or 3 hours has been like for someone on the other end of the handover. So if you're bringing me your patient from theatre, I don't know if that patient had a very difficult induction, a very rocky anaesthetic, whether you're at the end of a 12-hour shift at the hospital and you've had a patient, 2 patients that have had, unfortunate complications before that, and you've just given a 7-unit blood transfusion and you've been quite anxious that, potentially they're not going to pull through, and you finally get them to the recovery room or to the intensive care unit. You finally got them safe, and it's been exhausting for you. The last thing you want is judgmental commentary waiting for you at the other end. And so one of the things I say to our staff is surgeons, anaesthetists, ward nurses, they may have had a really rough time getting the patient to ICU. So maybe just reflect on that before you receive their handover. Just accept that maybe things have been tough and they've done the best job they can, and just do the best you can to allow them to hand over and feel confident in their handover and feel safe in the environment they're in, because we never really know how people have what sort of day they've had. And I think during the pandemic, that's especially important, because there are lots of staff out there that have had pretty rough days. Kathy Crock and I wrote last year, some of the staff not only are having a rough time at work, but I've been homeschooling 3 boys all day. I know what it's like to have stress at home whilst you're trying to get work done at the same time. And some specialists, anaesthetists and surgeons have lost a lot of work because elective surgery's been cancelled, so they've had loss of income. They might have spouses who have lost their jobs or have had their jobs stopped or restaurants closed. So there's a lot of stress out there amongst staff. So it's really important that we try and be as open in how we receive handover as we can, and not be judgmental.
That's one of the things I talked to about in one of the sessions in regards to people's coping mechanisms. Often when we are stressed and overwhelmed, we tend to revert to blame as a way of coping. I know I'm definitely guilty of it. If something's going wrong, blaming, the theatre staff members for not doing this, the staff members before for, handing over too much, you immediately want to go to that place and blame. So teaching staff that it's blame actually doesn't accomplish anything. You're not holding anyone accountable to anything. You're just busy raging and blaming someone for a few minutes to try and make yourself feel better. But at the end of the day, it often makes you feel much worse. And teaching staff members the difference between sympathy and empathy. In healthcare, obviously, if we are constantly empathizing with every single patient that comes through our door and feeling everything they're feeling, we can't do our jobs. We would eventually burn out so quickly. So we tend to revert to sympathy, being able to say, oh, that's really hard. That must be really difficult to go through, while protecting ourselves. And that works to an extent with our patients sometimes, but there is a time and a place where empathy is definitely required. And I think amongst each other, our colleagues, that's when empathy really needs to come through. You need to be able to, we've all been there, we've all been in that horrible shift, we've all been way too busy or had a really stressful day. So being able to put yourself in that person's shoes and feeling what they're feeling is appropriate in that time. And then, it gives you a better idea of what they need and what you can do to help them, even if it's just acknowledging that they've done a great job considering the stress that they've been under. And that's a big focus. What we do is that it's not necessarily about everybody being perfect. And by being kind to each other, we're not getting rid of that accountability. If someone hasn't done something, it still needs to be addressed, but it can be addressed by saying, did you know how to do it? Do you know how to find that information? Did you need assistance in future? Who could you have called to help you out with that stressful situation, rather than just not getting it done? So giving people options of how to be kind and how to look after each other, rather than just saying, this is kindness, go and do it. Giving people concrete examples of how they can be kind to one another, and also giving them examples of when they might fall into those habits that we've built after years and years and years in healthcare, those habits of falling back to blaming people the mistakes being made and how they're just not helpful, how they happen. But the best thing we can do is identify them in ourselves and go to whoever was involved and address that what we've done wasn't appropriate in that moment. And this is what I wanted to get done, and this is the way I should have done it.
Yeah, and we know, like from an administrator's perspective, the workforce is far more productive when the landscape is civil. So incivility is something that's spoken about. A lot of researchers in the US and in Scotland looking at incivility in the workplace. It's something that's appeared on the Gathering of Kindness program last year, and there's been some good research that's come out the last few years out of America, just showing how unproductive the workforce is when people are not civil towards each other. So being kind in the workforce will make people more productive. It's something that we know, and creating a culture of incivility, in other words, treating people poorly in the workplace, is only going to make the overall job that we're trying to do, which is deliver healthcare, to be done less effectively and less efficiently. And that's not why we go to work. So if we can all be kind and civil towards each other, then the biggest benefactors are not only going to be ourselves, but also our patients.
Yeah, so what were some of the ways you guys have addressed some of the more senior staff members who might have got themselves really set into those habits? How did you get them to really adopt the K-ISBAR?
Yeah, so I think with cultural change, it takes time, and there's always going to be individuals that are beyond making that change. But the two strategies that I think have been most effective, one is to promote awareness. So not through writing about it, but through presenting it at multiple hospital conferences or using other platforms to gather awareness about why it's a problem. And the second thing is to champion the positive behaviour. So hospital administrators are excellent at pulling people up on negative behaviour, as you mentioned. And really, at the end of the day, that is only so effective to be punitive towards people that are negative. Obviously, in the extreme cases where the behaviour is really terrible, that we've seen over the last sort of 5 to 10 years, certain examples that end up in the media, or people who end up having a fairly public slap on the wrist about some of their behaviour. But the majority of the poor behaviour goes unreported or occurs, as you mentioned, in senior staff, and it's something that's part of their long-term performance, for 10 or 20 years within a large hospital network. And in order to change that, the best thing I think is to promote the good behaviour. So to champion what's done well, for administrators to get on board and to really demonstrate to their department, or more broadly to their organisation, why kindness and kindness behaviours are most important. And are cherished or are respected by the organisation or appreciated by the hospital. So the best thing I think for you guys to do is to find examples of good behaviour and really put them up on a podium and champion them for other people to look at. That's I think it's just like raising children. You can only tell them off so many times and it doesn't work. But if you can champion their positive behaviours, they're more likely to change.
Yeah, that was the idea behind my little kindness box for people to call out kind behaviours. Our manager of education is also doing a staff call out. So every time that anyone logs into their computer system at LRH, there's a little staff shout out pop up that just has a list of departments or specific staff members who have been doing a great job in one way or another, just to call them out and let them know that they're being seen. Yeah.
And you can do that through email, newsletters, pin-up boards, posters, whichever way you have with communicating with the staff more broadly, is to show them examples of the best handover of the week, or the best received one, or if there is any positive feedback you receive from the surgical ward about the theatre staff, to really take that email or that letter and put that up and as an anonymous example of how well appreciated the behaviour's been, just so that people can see that it's making a difference. So you should be seeking feedback. I think it's important to get data with any of this. So you should be asking the staff, how many of you have had an unkind handover in the last month? And really look at that, and then maybe look after a couple of months and see if that's improved. And maybe ask people for, on a good day, what was the best your best day at work, what was a handover like with the surgical ward or with the theatre staff? And can you give me an example of a handover that made you feel safe or made you enjoy your day at work? Because we know if staff are enjoying themselves, if they feel safe and they're having a good day, they're less likely to get burnt out and feel cynical within the workplace. So seeking positive behaviours and then putting them up as an example, either in the newsletter or the staff email that goes around to everyone, is one way to really try and slowly drive the cultural change. It will take time, and there will be one or two senior staff that you'll never get through to, but as long as you're getting through to the next generation of staff, I think over time we're all going to benefit and the culture will change.
So I think when you asked us to speak to you, David, Annie and I saw this as a bit of a call to action to do something extra, something more. And in fact, what I've just heard you say is calling out the people who are doing exactly that. And I guess that's what you're doing here with us. But what I've also just heard you say is that, some people are too far down the track to change or may not be able to change. And, I actually firmly believe that, I came to this kind of work in recent times, having, spent most of my career focusing on the technical aspects. And I think that there is the potential to actually get quite experienced and far down the track specialists and senior staff to actually start doing things differently.
Yeah, and I think we need specialists like yourself, Andrew, that have got all that experience, that are seen as the senior members of the departments, because it's not just the junior doctors that look up to you, but it's also the allied staff, it's the nursing staff in theatre that look to the senior specialists. And so you have the most impact in your behaviours, given we work in a very hierarchical medical system in this country. So senior specialists do have the opportunity to have a huge impact. So if they're seen to be championing the cause, and if you're using those post-it notes and you're making sure that every handover you do is done kindly and you're making it visible that you're part of the process, then that's going to drive change a lot faster than just getting the interns to do it or the junior nursing staff. So it's really great to see specialists come on board, and as you say, later in their career, but that's only going to help. And again, the medical administrators, the chief medical officers and the medical directors in the hospitals, if they come on board, that's also has a huge impact as well. So not just senior clinicians in the hospital, but also senior medical directors and medical administrators can have a huge impact by buying into the process and being seen to be part of the new positive process, looking at introducing kindness into handover. If those senior staff are part of the change and part of the new program, then they will have a huge impact in getting the junior staff involved and getting the junior staff to see that it's a positive thing to do and something that will become part of a new culture.
I'm feeling really grateful to be invited to talk about what we're doing, and really, really glad to have people like Annie standing alongside doing this work.
I'd just like to say thanks to all the resources and everything that I've gotten from the team at Gathering of Kindness, and David and also Andrew for standing by me and helping me out and helping me come up with some ideas for how we can really drive this home at LRH. And I'm really excited for the changes we can make in the future.
Thanks so much for inviting me in today, everyone. And Annie and Andrew, thanks for all the great work you're doing with introducing K-ISBAR into your hospital. It's been an absolute delight for me to hear that that's happening. And I think K-ISBAR is in great hands in both of yours to try and improve in any way you can the environment in your hospital. And I'm sure it's going to be a wonderful place to work as a result of the work that you're both doing. So thank you very much.